As a paramedic, we've got a wide range of skills that obviously we need to have, because we could go out to absolutely anything at any time. However, the advanced nurse practitioners are more specialised in their kind of remit in terms of dealing with specific or chronic illnesses. Some of the cases might be, things varying from infections to wound treatment to kind of end-of-life pathways, and they can offer, various treatments and skills that we maybe don't carry, and also things like referrals directly to a department or a more appropriate pathway than just A&E. It supports the staff on the road, which therefore those staff can then support the patients directly. We don't know what's available, so having this team in place assists us as much as it does the patients.
We radio through to the crew, have a chat with the crew on scene, discuss what they've found, what their assessment is and what their thoughts are regarding an onward plan for this patient, and if it's something that can be dealt with in the community at home. So chest infections, urine infections and any exacerbations of any long-term conditions, respiratory and cardiac. The team that we work for have trained qualified nurses, advanced nurse practitioners. We've also got physios and occupational therapists attached. We've also got access to social care support as well if that's required. Many of the patients that we see are patients that are already known or have been known to community services previously. Sometimes we find that paramedics aren't fully aware of the services that we're able to provide and support within the community, and it's having that discussion to inform them and suggest care that we can put in and take responsibility for that patient's care.
So the advantages of having the A&Ps here with us is that we're able to get the right care to the patients. That will, in order, free up our resources to go on to further 999 calls and also relieve the pressures we do currently see in the emergency departments. It means offering a multitude of different services that may not always end up with a patient going to an emergency department. There may be more appropriate services like district nurse teams, rapid response teams, occupational therapists and physiotherapists, for example. We're having a great response from the crews, very receptive to it. We've made multiple referrals already this morning and we're getting some good feedback from the crews.